what an encephalocele is it, as the brain and the spine develop, they undergo this complex sort of folding process. And as they go through this process, the layers are supposed to close. And the way I always describe it, it's almost like a book is closing over a bookmark. And in the case of the bookmark is either the spine or the brain, the nervous system. Now, the process can sometimes be interrupted as all those layers are kind of folding and getting their messages twofold. And that interruption in the process leads to a communication that shouldn't be there. There's some sort of connection that shouldn't be there. There should be a layer in between there. And sometimes that leads to tissue, in this case, brain, being in a location that it's not supposed to be in. Sometimes we use sort of harsh terms like herniated to describe the tissue. It's basically just that brain tissue is in a location it's not supposed to be in, and the layers over the top, be it bone or skin or something called the dura or the meninges, that's the coverings to your brain, didn't close completely over the top. And as a result, you end up with an encephalocele. Now, they also go by other terms. So part of this discussion is sort of to help people understand when they get told other things.
Of course.
So an encephalocele is when the brain tissue itself has gone through that opening and is in a location it's not supposed to be. All of these conditions have as the common factor that there's some sort of abnormal connection. If it's just fluid in that little bubble or sac on the baby's head, then it's called a meningocele, and that's just the coverings of the brain, and then there's some CSF in it. Sometimes we don't know before the baby's born, and then doctors use the term cephalocele, which just means cyst on the head. And that can mean sort of multiple things in there. There's also something called a ruptured encephalocele. Again, we don't always use the best terms. And what that means is that the opening in the skull also, the skin is either incomplete or didn't close all over the top. And so that brain tissue is exposed to the environment, in this case, to the womb. And then the last thing to kind of talk about that can commonly be heard is something called an atretic meningocele or an atretic encephalocele. And those are usually small, and they're located on the head somewhere. When you see them after the baby's born, it looks like a little burn on the baby, and it might have a ring of hair around it. And that's basically that there was an abnormal connection, but it either kind of healed or it was so small that you don't see it there. And so while you may get the diagnosis of encephalocele, remember that it's not just one diagnosis. It really matters that you know your baby and their anatomy, and that's something we're going to talk about. So not all kids with encephaloceles look the same, even when they look the same. So.